Hi, everyone. Welcome to the PTI podcast. This is Mary here with Emmanuel, and today we'll be talking about something that everyone's been thinking about, which is the Health Minister's announcement regarding the changes to the NDIS. So, Emmanuel, thoughts?
Hi. Thoughts. Thoughts. Good one. How are you, firstly, Mary?
Yeah,
It's a
sorry,
big
I
topic,
jumped the
so I thought
gun there. I jumped the gun there.
we'll
I
get some
I'm
niceties.
good. I'm good. I've been experimenting with 3D printing, so that's been
Ooh,
how I've been spending my evenings. How about you?
ooh. Good, good. I just been working. We just finished the long weekend, which is great. I got some relaxing time in, and a little bit of extra prep time, and I scored 2 goals in 2 games for my soccer team, so I'm really excited about that. Secretly, not
Amazing.
secretly.
Yeah.
Just told
I, I,
everyone.
I wish my hobby was a little bit more active.
No, I like your 3D printing. It's not that I'm ever gonna. I can't try because if I tried it, I'd end up. Oh, it'd be a whole thing. I'd have to invest my whole life into it, and I can't do that right now.
That's fair enough. That's fair enough. All right. So I think a lot of people have been quite stressed out about the announcement. So maybe, Emmanuel, you can take us through the key talking points.
Yeah. So, for those that don't know, obviously I myself, I guess is in charge of running a support coordination service. So the reason why I mention that is because we have seen a lot of questions come through from participants from this speech. So I thought it'd be a great time to kind of unpack it. But I do, before we start, just kind of want to go over a little bit of I guess, a mini disclaimer. Look, essentially, we are about to have a discussion on the recent speech by the health minister the Minister for Health and Aging, Mr. Mark Butler, and essentially, we're just chatting about what he said. So we're commenting on the speech itself. We're not providing any legal advice or confirming how every proposed item will, eventually operate in practice. Like with these sort of things, in nature, any announcement, requires further information, legislation changes, consultation, and any of those things change may shape how these actually ultimately affect the community, right? So, with that said, if there is anything we talk about that maybe someone has a different perspective on, please comment, or even nominate yourself to come and have a chat with us. I mean, that is ultimately the purpose of the Pathways to Insight podcast, which I'm not even sure we said at the beginning,
I
but
think I just said PTI.
PTI. But that's ultimately the point. That's what we're here for. The whole point of us getting together is to learn and chat and hopefully speak to people a lot smarter than us to communicate out there, and show what good discussions are like. So I'll dive right in, because I've got some key talking points here, which we kind of will move and discuss and have a chat around. So, um, I know, ultimately a lot of what he was talking about was NDIS, but he did also make comment on a few things in regards to aged care, which I found interesting. I guess a few key points is that the aged care, which I think kind of we all kind of know, is we've got an aging population in Australia, and the demand for aged care seemingly looks like it's going to increase. He was announcing some, I'm not super familiar with what the government is doing around aged care necessarily, but he is announcing some I guess funding and programs. For example, he announced $200 million for 20 specialist dementia care units, which sounds amazing, and the expansion of the hospital to aged care dementia support program. About announced $1 billion so that showering, continence management, and dressing under the support at home would be free of charge alongside some clinical care. And there's a bunch of other changes. So that is, I guess, because he sits under both, and there was a recent amalgamation of the disability, um, you know, government department as well as the aging department, the aged care department. Obviously, he was commenting on what that growth looks like. I have a feeling that obviously there's some future amalgamations that will occur, just based on the fact that they're kind of bridging conversations and talking about both in the same. What's your understanding of were you aware of any of these aged care kind of changes or the recent reforms out of the aged care space at all?
I think, well, there's been a fair bit of talk about the changes in the aged care space, and I think also, isn't there also a commitment to a $3 billion budget as well for the more beds? I think it was.
Yeah.
Yeah. So I mean, we all know that aged care's been in the spotlight a little bit. I mean, not so much as much as the NDIS, obviously, but I think it's like it's good to hear that this sort of demographic isn't being forgotten, because as we know with the NDIS, I think, what is it, a cutoff of 65, isn't it? So so it's important that we're thinking about them as well. I think one of the interesting points though was that sort of the talking about how they want to kind of create these mainstream services. I think I'm going more into the NDIS sort of side of things, but they were talking about that I was really interested in that community participation program where they want to shift some of that community participation out into the mainstream, which I thought was really interesting. Yeah.
Well, I think, I mean, that was always, I mean, now I'm shifting a little bit into what he was talking about from the NDIS side, and I will go over some of the points. And I think from the NDIS perspective, I think we'll take our time going through the points. But that is correct. I think obviously for those that are aware, the original intention of the NDIS was not to remove what we're calling now foundational supports or mainstream supports and services for people. I guess it was more so to kind of fill a gap at that time, for this more, I guess, for certain gaps in supports. But what he was sort of suggesting is that over time, the NDIS became the sole reliant funding body, for lack of a better word, for access to the community, for certain care. And then he also was talking about the fact that the quality of these supports has kind of dropped in their opinion. So I mean, some of the points that he was specifically talking about, that I think it was very interesting to me that he obviously said this very clearly. In the first thing he said is that the NDIS will continue to grow each year, but the government believes that it's growing too fast and costing too much. It's very deliberate and specific wording. On that note, he was talking about things like fraud. There was a lot of emphasis on fraud and rorting with organized crime, and the poor integrity in the current system, which I'll go on. But on the fact of fraud and organized crime and that sort of thing, I think it's he was also very clear about saying that he's not talking about NDIS participants. He's talking about external, I guess, organizations from his perspective that are not doing the right thing by participants, or he was talking about the taxpayer. I'm curious, have you seen much of those sort of things happening? Have you witnessed anything like that?
Oh, witnessed, no. I think there was recently a news article about an organized crime syndicate, and I think they defrauded the NDIS by several $1 million. And I think the news article was talking about their arrest, but this was kind of very much like, we're not talking about necessarily like individual providers doing the wrong thing. Like, this is like a very sophisticated, criminal network. So, which I wasn't aware that it kind of was, that like these syndicates had kind of like come in like and was rorting the NDIS. So that was disappointing to hear, but not all that surprising, if we're being honest. So I did hear about that, but then in terms of kind of like what mismanagement of funds, like what have I personally seen? I think it's mostly been a lack of awareness as to how to charge, more so than like actual fraud, which I think there's a distinction there. So it's more about like people not realizing that that this service isn't supposed to be charged for, or not realizing that like if we bring up, what you remember, that YouTube video that went around recently, and they were looking at like what was it, like cleaners, and they were charging like two hours for only 30 minutes of work, and there was this misbelief that they had to charge that, when in reality I think they were confusing the like SHADS awards minimum hourly requirements in terms of shifts with what they were charging with the NDIS. That is, to me, like when I look at that, I'm interpreting that as rather a lack of information and not knowing how to kind of like like not knowing the difference between those two things and that kind of getting confused. Is it still wrong? Yes, of course it's wrong. But I think that's very different to someone going out of their way and actively, defrauding the NDIS.
Yeah, I mean, I said this, and shout out to Solomon for the Hot Wings podcast, which was super fun, but also thank you. And I know you did the same thing, but he asked me a similar question on and I guess he asked me a question on, I guess, what would fix the NDIS, and you kind of touched on my answer there, which is, I guess, holistically, from my experience, there's a lack of understanding on both sides. So the understanding of what the expectations are, and what the expectations are on both sides is sometimes not always aligned. And I think when he was asking me about what would sort of fix the NDIS, and I thought more access and more information between whether it be participants and the planners, or support coordinators and the planners, or whoever it may be, to get answers that make sense. And I think this challenge and the I guess the communication and the misunderstandings are only going to be exacerbated the more things change quickly. Because what I've noticed historically is that let's just say that for example, these new framework planning and these rules for these new framework planning sessions, well, not sessions, but the new framework planning, the rules are, some of the rules are communicated and some aren't, but those new framework plans, for example, aren't going to exist until April of next year now, right? But what we do find is that, unfortunately, everyone sits in this melting pot of too much information, and it's almost seems like everyone has a perspective, which is fine because this is how it operates. But it would sometimes, and again, this is what he was mentioning in his speech, he's hoping for a more sustainable framework that is clear about what can and can't happen, to allow for more, I guess, predictable outcomes. Now, what that means, who knows? But in the context of what you're talking about in terms of, this fraud and the difference between SHADs and what the NDIS is expecting and so on, I think it happens quite a lot. And sometimes it's not sometimes it actually, is not a good thing for the participant. For example, there are things that they can charge for, but people, may have an understanding or thought that they can't. For example, new rules that aren't actually in effect yet, or the definition, I always talk about it, the definition between a stated item and something mentioned in a plan, because stated items under the new framework planning will operate very differently, so to speak, to how they operate now. And I think sometimes that gets lost in translation. Or, for example, a big one, and I feel for plan managers here, is that information told to plan managers and what they're being what's focused on their side isn't necessarily communicated down. So there's a whole mispot of information. And I guess the point of these conversations and the podcast and so on is to kind of talk through some of those things, and try to help answer those. Although, yeah,
I think with that in mind, like you made a really good point about there being a lot of information, and it's almost like there's too much information out there. But I do think that that's in response to a lack of clarity. And I think that, like, so for example, like whenever I look at the NDIS website, like it's just filled with information, but it's so hard to navigate. So I just wish like there was almost like a user guide to the NDIS basically. But I also think like
well, there is.
Mark. Oh, well, okay. But I was going to say that Mark Butler made a comment about like there not being a minimum standard for invoicing. And I feel like I think when we were talking about this before we jumped on, and I feel like if that was sort of incorporated early on, there would be a lot more clarity about like what could and can't be charged, right? Because it's a lot like right from the onset, right as you're kind of like processing these payments, like you're learning right then and there as well, like what you can and can't charge for. But I mean, that's a conversation for another day. But you mentioned that there is a user guide. Please tell us about this user guide.
So I mean, I agree. You just opened up a whole other conversation as well. So just to be quickly clear, I did mention something, but just to state it, like the new planning framework has been delayed. So all of the particular direct rules for that has been delayed to April of next year, just to be clear, which also includes the use of ICANN and so on, which I respect. I think they need to get it right. So when you're talking about the reason why I mentioned that is because the current pricing arrangement document is the user guide. It is exactly what people can and can't do in almost every situation. Now there is also addendums and so on, and I understand the wording is a little grey in certain sections, but in my experience, I think people, I guess we're and I get it because it's a lot of information, and I think unfortunately, unless you've been in the industry since, I mean, I'm doing this for 7 years and ultimately obsessed, and some of the information that's been communicated now actually was in some of the reports early on. So nothing in this actually, except for one thing, which we'll talk about later, surprised me. But the pricing arrangement document is, for me, that guide. Whenever someone comes back to me and says I can't do something or I can do something, I actually refer back to it consistently, and say, well, what is the rules actually saying here? And unless something is directly, for example, there's quite clear rules on what is, different shift times and all these sort of things, and it tells you, as long as you've spent the time, because again, there is a lot of information in there. And I guess my understanding, and I need someone to correct me if I'm wrong, but the new framework planning and some of the rules around stated items and so on is coming later. We should always be referring to what I call the yes and no list, but it's the what's funded and what's not funded, and also the pricing arrangements to determine whether or not we can charge for something. But you also mentioned the invoicing. Small comment is, for anyone who hasn't, I would highly recommend reading the Independent Pricing Committee's report on the NDIS. In that document, there was a few comments, and it's been a little while since I read it, but there were some from my memory. Again, if I'm wrong, let me know. There were comments made about the fact that when people are invoicing, they don't always invoice. They sometimes clump under one line item, which meant that the NDIS doesn't actually know, because they don't have the data to suggest what is non-face-to-face, or what is, travel, or what is kilometers, or what is this, what is that. And I think what they're talking about in some of these future changes, which some of the comments he's making, which we're touching on, is having more access to that information to get it right. Because at the end of the day, if someone has $1 million or they have $300,000, ultimately the main question that needs to be answered is, do they have what they need in order to achieve, to support their functional capacity at that moment? That's the whole point. It's not about the number or dollar figure. It's about, is it relevant to them? That's for me the key point. So I hope that answers your question.
The only kind of comment I was going to make is that, like, yes, of course, the price guide is something to refer to, but I personally, like, I only really look at 3 line items, and I don't think they're quite clear. So, like, I'm getting confused. Like, oh, should I use this line item or this one? So I would appreciate a little bit more clarity. I think like, when the NDIS takes on our comments and does amend sort of opinion pieces or guidelines, like, it's so helpful. Like, so for example, a little while ago, they had the safe transport guidelines, and then, there was a bunch of feedback about some of the wording that was in there, and then they did a version 2 the next year. And I would say a year later is relatively a pretty good time frame for updates to come out. And that guide was so much better than the first guide. So when there is that sort of feedback process, like, it is so helpful and beneficial to everyone. But yeah, so moving on, what was another point that you think is worth discussing from that speech?
Well, I mean, what's not worth discussing? I guess when we were talking beforehand, we kind of wanted to just kind of talk through what was specifically said, because I know myself, through some of the, I guess, the consequences, and consequences sounds negative, but I don't mean it that way. I just mean like a natural, I guess, well, I'm going to say consequence again. A natural consequence of the speech is that, often people who are so in vulnerable situations are obviously, going to get a little worried if they hear things about their funding. So we got a number of questions. I mean, to put into perspective, that he was talking about an expected blowout of the budget by 13 billion over the next 4 years, and he needed to put in place certain corrective actions. He was talking about, which I might actually leave to the end because I think it's a larger conversation. He was talking about a direct payment system or a digital payment system that's direct to providers, and which coincides with I guess a spending on intermediaries, um, to be reduced. I think it's by 30%.
Did he define at all what intermediary is?
Not to my specific knowledge. I mean, there was like the comment around reducing spending on intermediaries and third parties was as mentioned as such. But then the digital payment system for me is, I mean, again, this is where I guess that disclaimer comes in handy because it's really up for interpretation until proper legislation or actions are put in place. But it sounds to me like something that may affect plan managers. But again, a lot of these changes aren't things that are going to happen overnight from what I listened to in the speech, and especially the comment around the reduction in overall numbers on the scheme. So there was a comment and a few questions that I've got raised and concerns where they were talking about, the scheme is currently 760,000 people strong. And he mentioned that by the end of the decade, and that's a very key thing, end of the decade, that the scheme should be sitting around 600,000, which the predicted growth at the current rate was 900,000. At the end of the decade, which again,
that's only 4 years. Like that sounds a lot bigger than it is, though.
Yeah, but 4 years at the end of the decade, we're not talking about something that happens immediately, and we're also the other thing I want to mention is we always knew that Thriving Kids was coming. It's not like they're dumping people, if that makes sense. So Thriving Kids also plays a factor, but they were mentioning people between 9 and above. Again, there was a few comments and questions even in the actual speech itself around specific diagnoses. And I mean, his response plays into what I've always understood, which is that the NDIS is, and we've kind of always operated this way. We focused on functional. I know we've had these chats before as well. We're focused on functional capacity over diagnosis, and that is essentially I think it was, what is it now, a year ago or 2 years ago when they made those I think it was a year ago, they made these legislative changes anyway to more formally move across from diagnosis to functional impairment, and focusing on what that person can or can't do, and putting in place supports for them to fill the gaps, for lack of a better word, to help them live their lives. And I think that kind of these numbers and all these things are centered around. So these reductions are going to be not like, hey, from what I'm gathering anyway, it's not going to be like, hey, see you later. There is an element of we need to build up, and was communicated, we need to build up mainstream and foundational supports in order to catch some of the situations that may not be originally intended for the NDIS. Now, what that means, I don't know. The other thing I want to say is obviously we need to be holistic and we need to understand that the implementation of these things are very important. So whether or not it actually ends up with foundational supports being ready to take on is something we need to monitor. Like there's no point reducing or removing people that need help, but not having Thriving Kids set up. Does that make sense? Like I know there's lots of talk, but Thriving Kids isn't something that I think he was talking about the fact that it's under discussion, and this wasn't in the speech itself, but in the questions after, where he was talking about that there are conversations happening about the design. So, yeah, there's a lot going on, but I guess I'm just trying to be realistic about what I'm hearing and what I've seen, in terms of how they're going to operate. But again, they could tomorrow decide. I don't know, but from what I'm hearing from them, the key word that I saw was end of the decade, which means that there is at least a plan in their mind. Whether we know ultimately what the plan what is at the moment, I don't know. But what are your thoughts on those few things?
I mean, none of this is really a surprise. I think,
No.
like for example, like you were mentioning before, like the functional assessments, like the conversation about ICANN's been going on for ages. Like this is not
Mm.
new. This is not new information. I guess like them wanting to cut the budget or to stop the growth again, not a new conversation. Like we already know this. I think they also mentioned as well in that speech, like mandatory registration. Again, not a new conversation. I guess I'm just thinking, was there anything particularly new in what he said?
No,
Uh,
there was, but just on your point in terms of things that are particularly new, I would
mm,
highly suggest that anyone who's um, within the NDIS ecosystem, that you definitely read the IPC document. You definitely go back and read some of the information around PACE, because all of this has been communicated or a lot of these things have been communicated for quite some time. For example, we knew a digital payment system was coming where there was an instantaneous payment option, direct to NDIS. We knew that that was the case. That had been communicated within the PACE. I don't know, I can't remember what the actual name of the document was, but that's been communicated for ages. The updated legislation has always communicated the idea of functional supports. The review of the NDIS way back, well, God, 4-5 years ago, had suggested some of these particular changes quite some time ago, including the way things are recorded, the information. The IPC was talking about data and the lack of data, and some of the things that he's talking about there were the case. And we always knew that there needed to be, the scheme needed to be sustainable. I don't think that that's an uncommon truth, but I would definitely just highly recommend going and reading those things to add some extra context to some of this information, because again, it's not new. We knew this was the case, and that it scares people sometimes to suggest that they're going to reduce the number. But we always knew that they were looking at moving people, for example, through Thriving Kids, and I don't know what the actual number is of participants that fall under that as well. So, but to answer your question, yes, there was something a little new that I hadn't seen before, and I don't know how I feel about it yet, if I'm honest. So there was a talk on focusing on the reduction of social and community participation funding. I don't know why that was so difficult for me to say. um,
yeah, they're rolling it back to next year's
there,
index or something, or prices.
yeah, so they're looking at resetting spending on social and community participation back to where it was last year and stop further growth in that area. I don't know what that means. I am hoping. Actually, I'm going to get your thoughts first before I comment, because otherwise I'll talk the whole time.
Well, I'm honestly equally confused because I'm not entirely sure what they mean by that. Like, are they talking about like literally just CP hours and rolling that back to the average of last year? Like, but then again, how does that make sense? Because plans are supposed to be tailored. But then again, at the same time, they also mentioned that $200 million investment into the communities fund as well. So maybe it's kind of a balancing act between like creating more mainstream services rather than the NDIS paying for those services. So I don't know. The wording was not precise enough for me to understand.
I mean, yeah, look, I mean, I guess it's maybe potentially, I mean, look, it seemed really clear to me in the sense of that they are going to be reducing or looking to reset essentially the funding for social and community. What that looks like in practice, I don't know. He talked about numbers, some certain financial numbers, and I don't actually, he was talking about them as per participant, meaning I think it's on average, if that makes sense. So, for example, they're not just going to give someone a certain amount of funding that doesn't need it. So that makes no sense. So obviously you're looking at it from an average, I would assume. Again, this is a little bit of an assumption. So what that looks like for certain people, who knows? He did make an interesting comment, which I would agree with. I think now that they're moving over to PACE and they have more visibility over what is being spent and what's not, they're looking at resetting funding that has been approved that's not being used, which has always been the case since the beginning of time. We've always seen that happen way back when. Even in the old Proto system, where we had to justify, why a certain amount of funding wasn't used. So I guess he's just kind of, just going, well, you're not using it, and you haven't used it for a while. Therefore, that funding is in that case going to be, reset. readjusted based on your average spend, for lack of again, that last part was a little bit of an assumption, but it's very clear, and it's interesting to me because I don't know how it's going to work in practice. I really don't, and how quickly it's going to happen. I think also, the in order for that to happen, there needs to be I guess a reassessment organized. I would assume, or maybe they just go in and automatically. I don't know yet, but there was no definite time frame. I might have to go back and re-listen, but there was no. I don't think it's immediate. I think it's something that they're going to do. But I don't see that happening overnight. I see it happening over a period of time. What that time frame is, I really don't know unless it was specifically mentioned. But from my understanding is it may not be. And you did mention the Inclusive Communities Fund. Again, it goes back to the original concept. The NDIS was never meant to be the sole funding for people with disability. I mean, I don't know about anyone, but I think the communities and society as a whole should have an inclusive, whether or not it's able to be done so quickly. I get that, and there needs to be a transition period, and this is now me moving away from the speech a little bit. But like, for example, train systems and bus systems and, local libraries and different, sporting grounds and so on, realistically should have a budget to make sure that area is I guess, accessible and inclusive for whatever that may look like, so that people can access if needed where possible without support. I think that to me makes sense. I guess it's always in the implementation. Do you know what I mean, Mary? Like, you could say funding amounts, but realistically it ends up with what is the
time frames as well.
Yeah.
How long is that going to take to build up, these resources? I think, okay, so then any other new pieces of information? I think there was also the commissioning supported independent living plan management and support coordination as well.
Yeah, they mentioned, I mean, look, from what I understand, they were looking at, okay, so this is a tricky topic, right? We all, choice and control, from my understanding, is not going to be removed, right? That's not what's happening here. I guess the overarching, what I read, so essentially there was what they call commissioning of certain areas of the NDIS, and I guess they were talking about intermediaries. I don't remember them specifically saying supported independent living, to be honest, but I'd have to double check that one. But for example, support coordination or navigation and plan management, for argument's sake. Commissioning, in my head, and correct me if I'm wrong, is essentially having a list of approved providers that people can turn to, that have obviously met a certain standard that the NDIA or the NDIS will have. Now, I guess it goes back to the for me, again, it's not something new. They've been talking about mandatory registration for quite some time, and this is just a personal opinion now, not a professional one or anything like that. But if I was leaving my vulnerable human person, my grandfather, who's just got my aged care actually, or my other grandmother, great great grandmother, who lives in a aged care, if I was leaving them anywhere, or anyone like that, I would want to know that they meet certain quality standards, right? So there needs to be a minimum quality standard, and I think that's, from my understanding, is what they're trying to communicate. Now, I'm not suggesting that for any shape of the word that technically NDIS registration in its current form means quality, because it may not necessarily be the case. However, what they're talking about here is from what I can gather, is that they're going to look at I guess a selected approved set of organizations that have met a certain criteria. And I don't know about you, but I don't mind stronger compliance.
No, or stronger, that doesn't bother me either.
Stronger practices from that way, or looking at what best practice is, or for me, I don't mind in any way, shape, or form. I think
I do
Um,
think though it can be a little bit overkill sometimes, especially
of
with
course.
like for example, like Allied Health, they're already sort of like governed by APRA. Like, do we really need another body of governance? You know, like the rules with regard to APRA like are quite strict as they are. Like I can understand mandatory registration for unregulated professions. Sure, that makes a lot of sense to me, but I just don't really personally see the point of double kind of compliance when it's kind of the same thing. It just the only difference is one costs way more money than the other.
Well,
So,
I
yeah.
don't think, because for example, in the speech he did mention, for example, we don't want to monitor or police everything. For example, going and purchasing a low cost consumable item that's specific to your needs from a local chemist main is not something that they are necessarily going to be super concerned about. But in high risk, vulnerable situations, they, definitely, like for example, support independent living or SIL, or, they're looking at in-home supports that isn't SIL, high risk scenarios, those sort of things. When you mention allied health, my viewpoint on that is that I think they should align with APRA for argument's sake. I think it don't. I think maybe the NDIS is an added module, but I don't think it necessarily needs a duplication of what APRA is already providing. I do think though, and I don't. I mean, this is my. I'm going to ask this as a question as well. Is that the NDIS can be a different space. How you operate clinically is a completely different thing to how the NDIS operates, and I think there definitely needs to be an understanding of how the NDIS operates in order for it to be, I guess, the recommendations to be balanced and holistic and essentially effective for the ecosystem that you're recommending. So I
Mm.
don't think by any way, shape, or form that they should have a duplication um, registration for allied health providers or someone like that. But maybe perhaps a module, for example,
Well,
that.
I don't know much about aged care, but I guess my initial question is that, you've got Allied Health working in aged care. Like, is there, certain registration that they have to go through to go through aged care? And I'm not, is there? I don't know.
I
Is
believe
there?
so.
There
Yeah, I
is?
believe so.
Okay.
Yeah. I
So
think
you have to be
every
registered to.
provider who works at and
Mm.
operates in aged care has to be registered, or they're
Do
working
you
through a registered
know
company.
if the registration is similar to the process of NDIS, or is it completely
It's
different?
way better. Sorry, way more scrutinized. Way more.
Okay. So are we talking about like the same process of like you have to be audited, then you have to like every so often, and like is that the same whole process?
Yeah, yeah,
Okay.
except
All
you
right.
don't pick your auditor. So you still pay, but they pick their auditor. So the auditors
Oh,
doesn't
okay.
have
There you
um
go. That's news to me. I had to say, as I said, I don't know anything about aged care. So because my big argument was, well, if it's not happening in aged care, why is it happening here? But clearly I was wrong. It is happening. So,
I guess it's going to happen everywhere. And
mm,
I don't think it's necessarily a bad thing. But when we're talking specifically about the speech, that is kind of what I gather. So he is going to, well, they are looking at mandatory registration, which ultimately then they're talking about getting, I guess, for what they call the short list of approved providers that have met certain criteria. What that looks like, I don't know yet. Again, remembering that the any of those particular changes hasn't been specifically mentioned to come through just yet. It's the first time hearing about it from plan management, and I don't
I'm
remember.
also wondering if there's going to be like some quota, like once they have like a certain amount of like trusted providers, like that's it, they won't accept anymore, or is it more going to be
Um,
like if you meet these criteria, then you're considered a trusted provider? I am
I don't
curious
know.
about how that's going to work out because I do wonder like if they're going to like if it's going to bottleneck like cause a bottleneck in terms of like services and like if it's going to result in like longer waiting times, for instance, if you only have like a small handful of providers that can, provide the service.
Um,
But maybe that's what they want. Like, I don't know.
I have
So,
a feeling there's going to be a bottleneck regardless of whether or not
mm,
they do that, because realistically, they were talking about, for example, for navigation, that everyone has access to a navigator in any way, shape, or form. Now, some of those may be traditionally like LAC programs that are adjusted to suit what that looks like and different things like that. So we don't really know necessarily, but there will be a little bit of that naturally. Again, it's always been the same issue consistently in terms of implementation of a scheme this size and a world's first, for lack of a better word. It's all about staffing and people at the end of the day. I think, again, if you grow from 0 to 760,000 or whatever the case may be, any amount of growth, it requires people. And in order and especially with how fast things have been moving in the NDIS, for example, the aged care only got their first reform, I think it was like 30 something years after, which was only recent. And that was the first reform from my understanding. So like now we've had many changes that have been occurring. So I mean, yeah, we'll see. But I mean, I guess I just like the purpose of the conversation today was that I think a lot of the information that was spoken about, which was, there was a lot of, and I guess rightfully so, some worry and concern. Um, Nothing is particularly new. They've just kind of, I guess, outwardly communicated some, specific numbers and so on without, like, there's obviously a lot more context to that. So, for example, how many of the reduced participants are actually already the thriving kids percentage? I don't know because I don't know that.
But I guess I'm also curious as to what that means in terms of like entry into the NDIS, because I can imagine that parents, for example, or even adults would be concerned about like if they've put off, applying for the NDIS and now they're wanting to, like how much more difficult is that going to be for them? How much more expensive is that going to be for them? Because they need far more evidence than say someone who joined 10 years ago. So I can imagine there's some concern in that arena.
Actually, that's a great point. There's a couple of things on that. So not in the speech itself, but afterwards in the questions, that was something that was raised. I want to go back to the thing that I was suggesting about functional impairment. So functional capacity or functional impairment is what they're focusing on. They have been doing that for quite some time, in my opinion. And I guess we have, as Ability Connect, have been doing that since the beginning. Look, I've always said this from a very long time. I don't need to know the person's diagnosis. I need to know what they can and can't do as a result. That's the thing that I need to focus on. Then I need to start looking at strategies. So to answer your question in terms of eligibility, I guess it comes down to what is the actual functional capacity. That is what I'd be focusing on in terms of what they can or can't do as a result of something that is naturally lifelong. They will be looking at things where, like, can medication help, or, if, for example, it's a child, they're going to be going through the potentially the thriving kids process, depending on the level of diagnosis. I would assume that not everyone is going to fit necessarily thriving kids. There may be those that require more specialist care that will sit in specialist teams. I know there are definitely specialist teams, especially the early childhood dementia team, that, for example, would for any diagnosis that fit under that would sit there. So in terms of eligibility, I don't think, and again, I know they've been doing this for a while. I don't think anything is immediately going to change. The only thing that I see changing it but it's not happening until next year, April, is the new framework plans where eligibility will go through, I guess you'd be focusing on I guess the ICANN assessment, for lack of a better word. And that ICANN assessment, similar to what happens with My Aged Care now. Have you ever done that before?
ICANN?
No, My Aged Care.
Have I ever worked in My Aged Care?
No, like, have you ever helped someone, or
like in a nursing home? Is that
no? Like no, not
so
like through the process, because I recently did it.
Oh, through the yes, I have. Yes, like the initial applications. Yes,
yeah.
Yes, I have.
See how you essentially apply, and
then
then
it's very simple.
they ask you a few questions, and then you immediately either meet the criteria for certain. I think it's going to be somewhat similar to that. And some of it may be NDIS, some of it may be foundational supports.
It's a little bit, I would imagine it's a little bit easier though for aged care, because it's literally like over a certain age, we all know that our bodies start to slow down. So it's like you're kind of like given immediately like the benefit of the doubt,
So that's where the ICANN comes in, I'd assume.
Yeah, okay. Yeah.
That's where the ICANN would come in. And there's PSQ. I can't remember the acronym for it now. There's another one that would potentially be of similar value as well. Again, we don't actually know in practice how it's going to go. This is a little bit of an assumption, but I'm just piecing things together as what I can see. And for eligibility, for example, the new framework planning is what is going to happen, where you go and do this assessment, then you have this third-party tool essentially that is essentially going to be a formula that they're going to release in terms of how or what funding categories or what you are eligible for based on certain standardized results. The word standardized is scary, but just bear with me. And then they're going to put you in, either you're going to meet this sort of this sort of criteria or this sort of criteria, and then and then off you go. I think also there is very clearly said that they are still developing the modules or the information for complex cases. So for complex cases, I think you're going to see a lot more of a traditional pathway for a very long time. For people, for example, with leukodystrophy or Huntington's or those sort of type diagnosis, you're going to see a more traditional pathway until they get it right. That is something that has been said, and I have spoken to a few people in those complex teams, and that's also what has been communicated to me, is that the new framework plans won't touch them until they're ready, because they are very aware of the level of complexity and needs and vulnerability of those individuals. I think what they're looking at the moment is how do we strengthen community systems to support those with what they call, I guess, have lower needs. What that means, like I'm just repeating, but who knows? But they're looking at making sure that the community is one that can support them.
Well, this is also like we can see this as a good thing, that
Mm.
slow and steady and well thought out policy is really what's needed rather than a rush job. So whilst it is frustrating and a little bit nerve-wracking, it's probably a good thing that they're taking their time figuring all of this stuff out.
I mean, look, it's going to take more time than I think.
Well,
in reality,
I'm trying to be positive here.
I know I am too. I just think, I mean, look, to be fair and honest, is everything comes down to implementation. I don't, in theory, have, except for the social community, which I would look at like, hang on, that needs to be done properly, and very contextually to the person that you're applying this to. I'm not, like, nothing is new, right? Nothing in particular. I understand they're moving things over to Thriving Kids and all these things, but implementation is going to be absolutely everything, and they need to get it right. And I'm hoping that everything has to kind of align. So there are many things that we don't understand or know about or are aware of on their side, as well as I'm assuming there's a lot of things that they don't or not particularly aware of from our side, which sounds scary, but it's true, right? You can only know what you know. And it was the IPC told me that they don't know everything. They don't have all the information, the data, which they're trying to get. So unfortunately, implementation is going to be everything. To play devil's advocate, it needs to be right. And there's no two ways about it.
I don't even think that that's you playing devil's advocate. I think that's just pretty obvious, isn't it?
Well, yeah,
implementation is important. So.
It's a tricky subject though, because sometimes it's difficult to talk about because you don't want to, but it has to be said, I guess, that the scene needs to be sustainable, but so there needs to be change, but that change needs to be implemented, effectively.
But I also think, again, it's not, well, yes, like implementation, obviously very important, policy, very important, but also clarity. Like I'm hoping this time round there's a lot more clarity. We'll see.
I mean, look, I don't, this sounds, I don't want to say this.
Maybe take a moment before you say it.
Well, I think whilst there's a lot of perceived, so not now, let's talk about 3-4 years ago. I think it's pretty clear what they wanted. I think the issue that they are having now is accessibility and how they determine who and what is the main priority for the NDIS in terms of overarching numbers of participants on the scheme. I actually liked how they were operating in terms of this healthy balance of push and pull from the agency obviously being there to scrutinize, and on this side the participants having someone who can help them communicate what they need, because ultimately that's a system that kind of can be somewhat flexible to support. I guess there was a little bit of what the scheme was actually intended to do was lost in translation, and who was meant to support was lost in translation a little bit. So anyway, I'm not going to go off a tangent on that. But so can I just ask for, I guess, in over, I guess for lack of a better word, closing comments. How are you feeling about the speech? Are you worried? Is there anything that stood out that was mentioned to you, or?
Mostly the intermediaries, if I'm pronouncing that correctly. but that was the only thing that I was like that I honed in on. Everything else was kind of like had been said previously, and like we said, those other unique comments that came up. But I think really, my closing comments are. I'm sure we've all seen the posts on LinkedIn and Facebook and what have you. And I think we just need to take a breath, and just kind of look at the source material yourself before we start getting pulled into this sort of, I guess, chaotic conversation about what's going on. I guess that's really the only comment that I can make. And for those listening, like, what are your thoughts? Like, what do you think? What are your concerns? Because, we can only see it from our perspectives. Like, we are coming from quite a privileged space. Like, especially myself, like, none of this stuff really impacts me personally. And so obviously I have a bias around that. So, but if it's impacting you personally, like, please, I'd really like to hear what's going on from your side of things.
And like I said at the beginning, this was obviously just a comment on what was communicated and what our understanding is. So things may change depending on when you listen to this. And we definitely want to hear, and we will be looking to see who out there in the community would love to chat about certain aspects of this that may be an expert in certain areas. So if you are one of those people and do want to put your comments, we are more than happy to chat, because again, the point of this podcast was for us to have conversations about things that are happening in our space, or even potentially outside our space, and learn. That was the whole point, a little selfishly, is to speak to people a lot smarter than us, technically. So with that being said, I guess on my side, thank you for joining us and tuning in. Please let us know if there's any comments or questions, or you want to jump on and have a chat about something about that we've talked about today, or in any of the episodes we've released. But yeah, thank you so much for listening, and bye for now.
Bye.
Bye.